Hello, today's lecture topic is surgical instruments. In general, surgical instruments can be divided into 5 classes by function. First group is cutting and dissecting instruments. Second group is hemostatic instruments. Third group is grasping or holding instruments. There are additional and retracting instruments. Fourth, tissue unifying instruments and materials. And 5 special instruments. First group is cutting and dissecting instruments. Abdominal scalpels used to make long, linear incisions. Sharp-pointed scalpel used for deep tissue dissections. Also, there is a scalpel with the removable blade and disposable scalpel. Incision depends on the scalpel handling by the surgeon. There are several ways to hold the scalpel. Pencil grip, fingertip grip, stab incision, amputation knife handling. Surgical scalpels. Surgical scalpels are divided into amputation knife, used for amputation of the limbs, cartilage knife, used for cutting costal cartilages and dense tissues, anatomical brain knife, used for brain dissection and autopsies, surgical scissors, can be straight, curved, axially curved. They also can be blunt and sharp. Surgical saws, arcuate saw, saw sheet, Olivecona wire saw, jiggly saw. Surgical saws are used to cut the bones in amputation and bone plastics. Hemostatic clamps. They're used to control the bleeding. It can be curved or straight. This is Billroth's straight clamp and Billroth's curved clamp. Cocker's clamp, mosquito clamp. Deschamps' ligature needle. They can be blunt and sharp. Cooper's ligature needle. Next group is grasping or holding instruments. There are additional instruments: anatomical forceps used for fine handling of soft tissue and traction, and surgical forceps for handling dense tissue. Surgical probes. This is the button probe used for dissecting fistulas, tracts, and foreign bodies. Groove probe, used for fascia dissection. This is Cocker's probe. Packer, sponge forceps, used for packing the wounds for handling surgical instruments. Towel clamps for Shadle Jones, designed for fixing surgical drapes around the wound. Next group is retractors. These are the Volkmann's sharp and blunt hooks. They can be single-toothed, 2-toothed, 3-toothed, and 4-toothed. Next is Farabeuf's retractor, used for wound retraction. Tissue unifying instruments. Needle holders. Hager's needle holder and Matthews needle holder. Surgical needles. Curved needles are classified as tapered, most commonly used in soft tissue such as intestine, and also for vascular and nerve suturing. Next is triangular cutting needle, used for tougher tissues such as skin. Atraumatic needle, used for vascular sutures. Special instruments. Special instruments used for narrow specialized operations. So these are the retractors used for abdominal operations. This is a C-shaped Richardson retractor. Duane's abdominal speculum. Liver retractor or speculum used for biliary tract operations. Mikulich's clamp for handling peritoneum. And soft elastic clamps used to hold intestinal lumen and prevent the contents of the intestine from pouring out while the intestinal wall is not injured. It's an elastic straight intestinal clamp, elastic curved intestinal clamp, and this is Peyer's intestinal crushing clamp. Bone cutting instruments. This is Farabeuf's respirator used for periosteum dissection. Costal respirator used for ribs. Bone cutters or rongers, used for bone cutting and also for cutting out round pieces of skull in trepanation. Leroy bone ronger, Liston bone cutting forceps. Igorov Freiden bone ronger, and Dahlgren bone cutting forceps. Percy amputation retractor. Percy amputation retractor is used for protection of soft tissues during amputation of limbs. This is Duane's trypan for skull trepanation. Surgical hammer with a hook, used for forcing movements on osteotome or chisel. A chisel itself could be curved and flat. Bullet forceps, used in obstetrics and gynecology for holding uterine tissue. Rectal speculum, used for diagnostic and treatment operations of the rectum. Thank you for your attention.